Welcome to this week's Magic Wand Moment. Today I'm joined by Erica Barnes, who is the Executive Director for the Minnesota Rare Disease Advisory Council. Erica, thank you so much for joining me today.
Thank you for having me.
So full transparency, Erica and I go back a few years. We've done this before, so we'll try to keep all inside jokes to a minimum as part of this conversation.
For Minnesota specific, terms.
There are a lot of things that overlap in our background and history together. It's going to be great. I'm really excited, though, for everyone who's watching to have the chance to learn from you, because I have learned so much from you over the years. Before we dive into that, I wanted to ask a question, which is, I always say that I was brought to the advocacy table. My seat at the table was earned kicking and screaming, meaning I really wish that I didn't know the things that I know. And I know that that's the same with you. You were brought to the table by the death of your daughter, Chloe, who is absolutely precious. And so before we dive into talking about what you do now in honor of Chloe, I would love to just know, what is your favorite thing about Chloe?
Oh, I love it. Thank you for asking that. It's a lovely way to ground myself in this conversation. So I think the thing that I love the most about Chloe is how spunky she was, and how, each of your kids are so different. And I had my daughter Ava is older and Chloe was the younger. And Ava's personality is just so lovely and empathetic. And so one of the funniest stories I have about Chloe is how if my husband and I would kind of, wrestle or pretend fight or whatever, Ava would always be, "Oh, Mom, are you okay?" And Chloe would just giggle and laugh. And she was so spunky. And I feel like that spirit just continues into the work that I do now.
Yeah, I would say you're a little spunky too, and I love it. I'm here for it. I think it's why we get along, to be honest.
That's right.
So when I first met you, you were working as a speech pathologist. You were running a nonprofit, and then you were channeling some of Chloe's spunkiness to work with global experts in leukodystrophy to help find treatments. So your average workload, obviously, not to mention having children at home that you were also managing. Can you tell me how you got involved in the work that you do now?
Sure. So I really, the work I do now really grew out of sort of a concept of leadership that I've really come to. I always tell people I don't think of myself as a leader. I don't think of myself as having. I wouldn't have been like, oh, I'm going to go to college to be a leader. But a lot of the work that I do now, I think, grew out of a leadership style of constantly, relentlessly looking at where are the gaps and where are there spaces where people should be doing more and it's not getting done. And so that has really driven me every step of the way in my advocacy. And so one of the things that I was noticing is, when I was doing my advocacy for Chloe's particular rare disease and leukodystrophy, I noticed that the same barriers to care and the same sort of systematic issues that the leukodystrophy community faced was the same barrier. This was being replicated across all rare diseases. So I would go to different, policymakers or different leaders and say, hey, I'm noticing this gap. And sometimes I would have assumed they would be like, oh no, that's not really a gap. Oh, but so many times they would be like, yes, that is a problem. And then there would be an awkward pause. And so, I really realized that, I needed to just go to those spaces where there were gaps and there weren't maybe people that knew how to address those gaps, or maybe just weren't doing it. So that's what brought me to this policy work and this leadership at the council.
I resonate with that a lot. It's interesting. When I started my work after Rona died, I just assumed that I would get more pushback than I do. And often it's saying like, hey, there's this gap. And people are like, yes, it does. That is a gap, right? And so you're like, so what are we going to do about it? That's why people like you exist. So I realize I just threw out Rare Disease Advisory Council. You and I have both worked in rare for a while. Most people who work in rare have likely at least heard the term or heard of an RDAC. But for people who might be newer to the space, can you explain what an RDAC is and the role that it plays at the state level?
Sure. And I have to say that I think we're up to over 30 states having a rare disease advisory council, but everyone looks a little bit different because every state is different. So, but the general concept behind a rare disease advisory council is, a multi-stakeholder group of people, a legislatively passed entity that is tasked with advising a state on ways to improve care for rare diseases. In the state of Minnesota, ours is actually an executive branch state agency. So we actually have a really amazing perch here in the state of Minnesota. And so we focus on a lot of policy expertise and support of the medical community and then empowerment of the rare disease community. So that's what we do in Minnesota.
And you got involved in that from sort of the very beginning, really pushing for that. What was the transition like from running your nonprofit and working in advocacy that way into working more generally on the RDAC for the state of Minnesota?
Yeah, it was kind of a transition of breadth more than content, right? So it was kind of simply taking a lot of the insights that I'd learned in my particular rare disease community and really expanding it and trying to address those issues more broadly across all rare diseases. And I suppose the transition also there was some transition to having a more systems approach and really making sure that I was understanding the way things kind of hang together in healthcare. So I think one of the big transitions I had to make and one of the big mindsets I had to have is thinking about our healthcare system as this very interconnected thing. And, there could be unintended consequences to certain, changes to the healthcare system. And so really wrapping my brain around the complexity of healthcare.
What was the biggest surprise as you dug into those nuances and the complexities of things that emerged?
Yeah, that's a great question. I think the greatest surprise is that the system is full of people trying to do their best, but often in a small pocket. And I was surprised that, it's not an issue of, people being apathetic or people just not wanting to change healthcare. It's really people doing great work, but maybe not in an interconnected way that really sort of takes into account everything that's happening across the system. That was a big surprise and a pleasant surprise in some ways, right? That, wow, there's a lot of people working on a lot of things and trying to do really good work. It's a complicated system.
Yeah, absolutely. I think often you would think that the conversation is more, we need providers to be doing more. We need, we talk about this monolith of sites when we're talking about research, but sites are really providers. They're hospital systems, they're clinics, and often they're the greatest allies of the families. And I think that gets overlooked sometimes when we're talking about these disparate entities within the healthcare system. So.
Yes, and that's so important. I say all the time, I don't want to ask providers to do more. I want them to think differently. It's not a matter of making more effort. It's not a matter of caring more. They care. They're doing their best. But we do need a mindset shift when it comes to rare diseases in the healthcare system.
What would that shift be?
Yeah, I think some of the shift would be a better understanding of some of the unique challenges that someone with a rare disease faces, more education around what somebody coming into your office. One of the big shifts I say too to young medical students is you're going to have to learn to be a student and a teacher, because that person walking into your office is probably going to know more about the disease than you do. And you're going to need to be a learner for a while and let them teach you. And that's a big mindset shift. Physicians are taught to, because it's not even a shared decision making model. Like that's something I think the medical community is getting with. It's that person is an expert and you're learning, and they know a lot about their disease. On the one hand, there's research that shows that, people with chronic, complex, life-threatening diseases want their physician to have the expertise. And so, of course, a physician is walking that fine line of finding, having that, being able to comfort the families that we got this, but also take that information in and the humility. So it's a really tough balance. I've often thought it would be nice to, maybe write it, have a script for physicians and really capture some of the phrases that have been useful that I hear over and over from rare families are useful, and maybe the ones that are not useful, so that physicians kind of have some of that, the language that they can use.
I think there's an appetite for it, so I'm going to put in a plug that you should be doing that, because that's actually it segues really well actually to my next question for you, which is that I think Minnesota is really, in my opinion, and I'm totally biased being from there, but I do actually think this to be true, that you've really been at the forefront of rare disease work. And I know you would never say this, but I think it's in large part because of the pushes that you've been doing, and obviously the amazing empathy and that we find in the state too.
Yeah.
And I think there's a genuine desire to make things better. But I do think it takes a champion, and they have found that in you. What has been the biggest challenge in the work, and then what are you most proud of?
Yeah. That's such a great question. I think one of the biggest challenges is just, you know, being able to figure out how to put rare diseases in the priority list, right? Because healthcare is grappling with so many things, and there are so many meaningful changes and meaningful reforms that we need. So really a challenge of being able to figure out that priority. How do we keep rare diseases at the high priority list for the state and for the healthcare system? I think another challenge, which is a wonderful challenge to have, another big one on my mind is how do we adjust the whole ecosystem to some of the amazing innovations in treatment and diagnosis? That was definitely not something, when Chloe was diagnosed, we did not have the amazing sort of pipeline going on with rare diseases. So the system is really, the whole ecosystem has to adjust to all of these novel treatments that are coming on the market. It's an exciting problem to have, but it's a challenge, right? So how do we make sure that access for these medications is front and center for everyone who needs them? So
Yeah, there's a definite shortage in folks who know how to do transplant or transplant adjacent activities, and yeah,
and the
definitely.
workforce, and
Yeah,
I mean, just so much that needs to be
the
done.
nursing staff that has to be in place for those types of treatments to be taking place. But you skipped the most important part, which is what are you most proud of in your accomplishments?
Yeah, I think one of the things I'm most proud of is just the general awareness in the state of the rare disease community. And I can think of an illustration of this so clearly. And I was so excited when I started the work specifically at the legislature to get the Rare Disease Advisory Council passed. It was just, one by one, educating lawmakers what is, rare diseases are not that rare, there are 10,000. And so really just not a sense at all of just even knowing anything about the rare disease community. And what I'm most proud of is rare diseases are just talked about all the time in our state now. And there was one committee where one of the legislators I had specifically talked to and educated, we were in a committee, there was a committee hearing, and somebody brought up the issue of rare diseases, and this legislator piped right up and unmuted her mic and said, rare diseases are not all that rare. There are 10,000 diseases.
It's amazing.
Yes, the student has become the teacher.
Totally. It's one in 10 people, right? But it's 1 in 8 households, was a new report released last year in the United States, are affected by rare disease.
Right.
It's amazing. Education is key, and I think you've really been, like I said, at the forefront of pushing that visibility and pushing the education. So I'm very proud to know you. I I'm cognizant of time. I wish I could ask you 1,000 more questions, but I do have one. It's the namesake for the series that I want to make sure that I get to. So, you and I meet once a year for a pancake breakfast, and we talk about a
Yes,
lot of
we
things, life and everything, but we also talk about the conversations that we can't believe we're still having when it comes to rare disease and to pediatric care. So, my question for you is, if I imagine I'm handing you a magic wand right now, and you could wave that, and whatever you wish for will come true, but the only rule is that your wish has to be for a change in how we deliver pediatric care. It could be related to rare, unrelated to rare, and for the patient or for the caregiver. Lots of things to
Yeah.
choose from here. What would be your wish and why?
Yeah, I think if I could wave a wand, one of the first things that comes to mind is, especially when it comes to pediatric care, that we would understand that when you treat a child, you're treating a family. And there's a whole sort of ripple effect that needs to be on the radar of a whole care team, right? So when I think of the effects of the long-term effects of Chloe's illness on my daughter, right? So we've got siblings, you've got parents' mental health, you're trying to hold down a job. My husband would go I took off for Chloe, but my husband would go from a high stakes meeting in his finance, role to how's Chloe doing? Did I miss her procedure? And so, sort of a mindset that we've got to treat the whole family unit, and we've got to be really comprehensive with how we address this. And it's not just curing this one child.
Yeah. Yeah, it is the whole family and the community and the care team often too, with the amount that they invest. So, yeah.
Yeah. And that everyone would take care of their health, right? Their mental health, and take care of themselves. Because you're right, we're all humans, and this work is really hard, and um, just everybody kind of being supported with mental health, as well as the physical cure of the kids.
It's tough work, but you make it look easy. It's unfair to everyone else involved. But again, as someone who's dealt with rare, I'm so fortunate that there are folks like you who are out there on the front lines advocating for families, for patients, for care teams entirely. And just in awe constantly of all that you accomplish. It has been such an honor to share this space with you today. I look forward to our next debrief over pancakes.
Yes.
Last question for you. Where is the best place for people to learn about your work?
Yeah, I think probably we have a website. So and I'm actually not sure exactly what the
We
what
can put it in the
a
notes.
couple times. Thank you.
Yeah, send it to me after. I'll link it.
So we have a great website, and the main reason I would love everyone to look at the website is all of the pictures on the website are of kiddos with a rare disease, taken by a mom who lost a child with a rare disease and now does photography for children with rare diseases. So
Amazing.
it is every one of those beautiful pictures. They look like models. They look like professionals. They are children with rare diseases. So
Love it. Fantastic. Erica, thank you so much for your time and for your thoughtful discussion today, and I look forward to talking again soon.
thank you, Lindsay. Take care. Be well. Bye bye.